Hello, I'm Dr. Maria Solindro. I'm specialized in integrative anti-aging medicine, and today I have a very special guest. And my guest is Dr. Helen Kizler. So let me welcome you by introducing Dr. Helen. Hi, Dr. Helen.
Hi, Dr. Maria.
Oh, okay. So Dr. Helen is a Pharm.D, that is Doctor of Pharmacist. She's the medical director and the founder of Earth Compounding Pharmacy in my area, which is Pasadena, California. Both of us are practicing in the same community. So this YouTube is meant for community awareness. Today we are going to discuss the topic about skin health restorations. Dr. Helen received her doctoral degree in pharmacy from USC, University of Southern California, in 2002. Her passion is the field of anti-aging and preventive medicine. Perfect, right? She has developed an expertise in hormone replacement therapy for anti-aging and cosmeceutical. Cosmeceutical is very trending this day. It will beat all the commercially available cosmetic, basically, right? Because it is personalized to you when it's prescribed by your physician. She works with many physicians to create the best treatment plans for their patients. I have the honor to invite her today to explain about her expertise and to improve this community awareness. So basically, Dr. Helen, many of us do not realize that our skin that looks beautiful today will one day age and surprise us all if we do not take care of them. Let's learn a little bit whether we can still at the stage of damage control, I said. So Dr. Helen, what is the definition of aging skin?
Aging skin can be defined by appearance of fine lines and wrinkles, loss of volume when skin gets sagging, loss of elasticity when skin becomes less firm and you can see deeper wrinkles. It is also starting to look dull and less radiant. Skin aging begins as early as 25 years old, and one can observe aging skin throughout the years.
Correct. I agree with that. What we call a subclinical, where you don't even see any sign yet, it's around 20 to 30 or 40, or maybe 35. In my view, as an integrative anti-aging medicine doctor, the cause of aging skin can be due to internal and external assaults. What about in your views? What causes aging skin?
Absolutely, there are two different factors of the aging skin, internal and external. Internal, there's nothing we can do, or maybe there is very little we can do. So the first one is hormonal influence. As many of you may know, after the age of 25, the hormone levels start going down and down until we start hitting andropause and menopause times. So what happens to our skin when hormones leave our body? Obviously have profound effects in your skin. The second one is vascular system. When we're young and the vascular system is strong, our vessels can deliver high amounts of water and nutrients to the surface of the skin. But what happens when we're aging? The vascular system gets weaker and the delivery of water and nutrients gets diminished. And the last one is genetics. Skin type we're born with will determine how fast or slow skin aging takes place. Now let's talk about external cause of skin aging. The major external cause of skin aging is oxidative stress. You may have heard a lot about oxidative stress, but
Yes.
let's define it here. It is the process by which skin damage occurs by breaking down skin cell structure and function. Usually, antioxidants are present in our skin in high amounts when we're young. Those antioxidants help to neutralize the oxidative stress. But as we age, the amount of antioxidants are decreased, and we're not as resilient to oxidative stress. Number one damage that causes oxidative stress is sun exposure, something called photoaging, or also called photodamage. Failure to cover skin and protect your face can be so damaging that it can possibly even cause skin cancers. Oxidative stress is also caused by pollution, smoking, insufficient sleep, and poor nutrition.
Wow. Yes, those information are very valuable because people don't realize, and that is when their time is spent with their friends, going outside, very active. So they are subject to all those assaults. Thank you. And we all hope that our skin is like a car where we can just go to a body shop and restore the body. But of course, that is not the case. So what is now meant by skin health restoration?
Skin health restoration is the ability to restore skin to its optimal condition, return moisture, elasticity, improve wrinkles and fine lines, give it back radiant and youthful appearance.
Wow, okay. So knowing that, I think the earlier the better, right? And to us, we want to see results, which is more healthy skin and hopefully beautiful and restore to the fullness. What is the main objective of skin health restorations? What do you think?
I think prevention is the key factor in skin health restoration. Once the skin damage already occurred, it is a lot harder to reverse it. It is much easier to prevent it. And no matter how young or old you are, your skin is going through a normal aging process. However, there are a lot of things we can do to prevent skin aging and oxidative stress.
Okay. So younger the better, and don't wait until it's too late. I agree with that. Are there any certain activities or rule of thumb? What is the skin health restoration activity to prevent skin aging?
In my opinion, good nutrition is really number one factor. You want to be beautiful inside out, and your skin actually shows what's happening inside of your body. So foods high in antioxidants, such as carrots, apricots, oranges, citrus fruits, blueberries, leafy greens, are full of antioxidants. And the more you consume them, the more antioxidants you have to fight off oxidative damage. A good sleep is very important. 7 to 8 hours per day is preferred. Hydration, drinking 3 to 4 liters of water per day. Taking vitamins that can restore missing nutrients your body and skin needs, like vitamin D, vitamin C, vitamin E, vitamin A, fish oil, CoQ10, exercise. Sweating helps to eliminate toxins that are accumulating in the body, which in turn will help prevent oxidative stress. Regular face washing routine will remove dirt, pollution, and other toxins that accumulate in our skin. Covering your skin from sun or using sunblock would be another way. Also applying high quality, non-irritating, non-toxic products that are nutritional and hydrating and designed for your skin type.
Oh, okay. Well, some listeners are very young, I'm pretty sure. They are 20ish and perhaps 30, 40 years young. No clinical aging sign yet appears on their skin. What treatment program do you think should be carried out for patients with relatively young age and relatively healthy skin? What do you think?
Well, I think it's very important to start early. For example, regular face washing removes pollution, dirt, and other chemicals that are accumulated on your skin throughout the day, Removing them will prevent oxidative stress and will help skin breathe better. After that, after cleaning the skin, one should put a good moisturizer or hydrating agents, and it will improve elasticity. It is important that you use products that are appropriate for your skin type and do not contain harmful ingredients. Choosing day cream with sun protection, as protecting your skin from oxidative stress is the #1 thing you can do to prevent skin aging. However, make sure that your day cream does not have titanium dioxide, as it is damaging to your mitochondria. Make sure your day cream has ingredients for skin nourishment and hydration. Young skin does not require extreme interventions, so giving it nourishment and care will go a long way.
Yes. And that titanium dioxide is very dangerous, actually. But I know people have changed and they make a new compound for the like sunblocks without it. That's good. Well, I hope people are listening, and so take a serious thing about this one, since they have to start when they're young. So some steps in daily life, I believe, creates a problem of faster aging skin. What kind of skin care steps cause what kind of like a skin care steps that cause deterioration of the skin? What do you think about this area? Because some people they make a mistakes using a certain things or doing something wrong. Can you give us an enlighten this in this area?
Absolutely. I know everybody wants to purchase whatever product possible to make their skin look better, but it's not necessarily is the best thing for them. For example, deterioration of skin can be caused by expired makeup, foundation or brushes or skin products. They may contain bacteria or fungus that can create problem and speed up aging process of your skin. Another factor that can cause deterioration of your skin are products that may contain harmful and unwanted chemicals for your skin, such as BHT, sodium lauryl sulfate, formaldehyde, oxybenzone, parabens, and many others. So watch out for them and try to use skincare that is free from toxic components.
What's BHT?
It's a very lengthy name. I don't want to confuse our listeners. Is butyl hydro tetra something, but it's usually abbreviated as BHT, and it is a preservative that is used in a lot of compounds.
I see. We have to remember that. Okay, well, thank you for the list. Now, maybe we can just use an example now. For example, a patient came to me with complaints of acne, rough skin, unpleasant complexion. So far, the patient have been using skincare with a cosmetic base that they purchased very expensive because they are very famous, like SK2, or those Korean made in cosmetic are very famous now with young people, and also La Mer, or all kind of brand name you can find it in a department store. So they use it for months, but there has been no improvement. Is there anything wrong that they probably apply in the wrong timing or wrong complexion? Can you share with us with this kind of situation?
Sure. You can buy definitely expensive products. However, if you're using a product that doesn't fit your skin type, it can create more harm than good. For example, if your skin is already oily and you're using products with oily consistency, it would be adding to your oily skin and not helping. A lot of products are made to fit all skin types and may not resolve your particular skin problem, therefore not helpful to fix your skin condition. It works a lot better when you work with your doctor and your doctor identifies your exact problem And a compounding pharmacy can make a product that is specific for your skin type and addresses your particular issue.
Yes, this is the reason why I really would like to invite you, because I think community does not even realize that this can be done, because these ones we know that they are, you know, they have a lot of comedo and big spore and a lot of oily skin. They cannot just simply use an expensive cosmetic that is very oily. I agree with you. But do you think these cosmetic agents that are sold in the market prevent skin aging? Because they make a label, you know, like anti-aging, prevent wrinkles, whatever. What do you think?
Well, I think you can be lucky to find a product that is high quality and fits your particular skin type and delivers results. It's possible. You're definitely taking a chance. Probably will take a while for you to go through the market and try this, that, or another product that you can obviously see the results. However, it is done better if your doctor evaluates your skin and product prepared specifically for you, for your exact skin type, and designed to address your specific problem.
Oh, yes, I agree. Yes, yes. I think for people who are careful enough, they come very early during their problematic skin. And well, to tell you the truth, I was having a lot of problem with my skin when I was in the 20s. That's because my hormone was not balanced. You know, too much testosterone with a lot of acne, and any kind of cosmetic I tried failed. Except one day I saw there is a doctor, um, Arno Laszlo. You remember that guy? He passed away a long time ago. I think his product was then bought by Chanel. You know, when I saw his name, at that time, I also, of course, as a young physician, I didn't know that I have to go to dermatologist, of which I went. I went several times and they treated my acne. Oh my goodness. So it's very painful. But you know, as if you are the person who has the acne, you really wants to get rid of it just that minute, right? So I also shop around and I found this Dr. Arno Laszlo's product. And apparently it fits my face because it doesn't have too much alcohol. So I am also allergic to alcohol. So many cosmetic products outside, they recommend their client to buy everything like the whole set. And one of them, it can be, it does not fit their skin. So that create a problem there. So that was my problem. But more than that, some skins are more dry than others, very dry, and often they itches and they can crack easily and very painful. So for a very dry skin type, what hydration should you use? Do you also make some hydration products?
Uh, for very, very dry skin, you pretty much can use the same moisturizing creams as you normally would. However, you can apply them 2 to 3 times daily to satisfy very dry skin condition and give moisture to your dry skin. Yes, we prepare products that contain hyaluronic acid, which is a substance that is normally produced by the body, specifically produces it in high amounts when we're younger. That's what makes our skin look so youthful and young and plump. So we incorporate it into a base of our cream.
I see. Okay, so that's a hydrating cream, right? Hydrating, you call it hydration for hydration cream?
We work with doctors and doctor tells what specific active ingredients to put in a cream, but we're putting that agent in a base to make it more hydrating.
I see. Yes, yes. Thank you. So, you know, let me read a question here that we actually had mentioned something. So this triggers these questions. Colin asked, sunblock I thought sunblock was not good for the skin. So that's her comment and a question mark. Do you want to answer that?
Sure. Well, I am one of the very big people who are against any toxic things, and sunblocks do have a lot of very toxic and damaging components. And I personally don't like using sunblock myself. I rather cover my body with hat or clothing and avoid the sun. However, there are really times when you do go to the beach, you know, we all have kids and they enjoy it, and we are exposed to really bright and heavy sun here in sunny California. So what I do, I try to pick a product that has minimal amount of those toxic components. And really, there's a lot of companies that take pride in the organic and minimizing toxicity, and definitely avoid the sunblock with titanium dioxide.
Okay, so basically the answer is sunblock without titanium dioxide when you are prepared to go out and do a sunbathing or you go to the ocean side. Put something to protect, but not the one that has titanium dioxide. Now, I cannot use sunblock. I haven't used sunblock for 30 years maybe. And I use all kind of, you know, hats and, you know, the the Ninja Turtle things that cover all kind of angle. So I am very sensitive to sun as well. Some people think that my skin is good, but, you know, very sensitive. Now, if we need to keep the skin moist, you know, we are fortunate that it's not humid in this area compared to people who are in Asia or near the, you know, what do you call that? A place where they are very, very moist, for very humid. But so it does not, but still during summer, it is so hot. Sometimes I feel like my skin almost crack and, you know, and then you need the humidity to prevent the wrinkle. This is the goal for prevention of aging, I think. But is it true that moisturizer can prevent aging? Because I think hydration prevent aging, but what about moisturizers that they sell everywhere?
I think having your skin moisturized is a key factor in preventing aging skin. Since due to aging process, skin loses moisture, which in turn causes dryness, skin cracking, and possible infections. However, other discussed interventions may be needed as well.
Okay. Dr. Helen, someone asked, what is helpful for people that are prone to have cyst, or I think this is cystic acne, yeah? Just under the skin?
This is a very good question.
Okay.
Cystic acne, from scientific point of view, a lot of times is connected to hormonal imbalance. It is one of those things that you actually need to handle from inside out, where internal testing needs to take place and see what really is the cause of it. So I would definitely check your hormones and see what's happening with testosterone and other hormones. And for example, there are things that can be, you know, you may have to go to your gynecologist to get inspected and see if you have any cysts, and that may be the cause of high testosterone, which in return can cause cystic acne.
Yeah, that's for women. So Daniel asked the question. So Daniel need to check his hormone. And I do agree, hormonal can cause cystic acne, but I also found out that magnesium and iodine. So iodine actually helps the thyroid hormone and magnesium helps everything. So development of cysts everywhere in the body can be helped by these two minerals, which is magnesium and iodine. Another question would be, Dr. Helen, these are all, let me just clear all the questions before I let you do your take-home message.
Sure.
This one is, do you recommend sunblock for young children?
Ah, what a question. Knowing how kids love being on the beach and being in California, I know every weekend we would go to the beach with my kids. So I would always try to cover their bodies fully using clothing, and also wear, the kids have those hats that actually have the ears and the front, but I was using some sunblock on their faces as well, as it's impossible to fully cover all of the area, especially when they go into the water. So just once again, choosing a sunblock that is minimal in toxic ingredients is the key here.
Yes, thank you. Thank you. Next questions. What do you recommend for prevention and protection of mosquito bites, especially when traveling to areas like tropical islands like Jamaica?
Wow. I personally prefer barrier methods. I think the repellents are usually pretty toxic. I would not use them myself. I would rather cover my body and not allow them to do it this way. Just really body protection versus skin repellents.
Oh, I think one thing that I found it's very useful is what is that called? Oh my goodness, we drink it every day. It's it's the type of the mosquito for mosquito is called I will tell you this next one first. Okay, I agree with Victor. He said the frequent use of sunblock is one of the main reasons why we have such low vitamins. Yes, the vitamin D, right? Do you agree? Yeah. So for those, thank you so much for that statement. For those who live in the dry areas, would you recommend a humidifier?
Absolutely, yes.
I think
I
so.
definitely love humidifiers. They really bring the moisture into the space so you can breathe in and your nasal passages get hydrated. I love them a lot, and I actually have one at home and I sleep with one.
Ah, thank you. I remember, Dr. Cynthia, it's lemongrass. So you can buy this lemongrass essential oil from lemongrass and you spray it on your skin because it's not toxic and mosquito will not bother you. I always carry with me. And then I also buy a sticker that has lemongrass actually, or citronella, and you just stick it near your, usually it's your neck and your lower leg that they attack, right? So you stick it there and they just stay away from you. Don't forget, okay, take me to Jamaica. Don't go alone. And so, let me see. Yeah, those are all the questions we answered. Now, Dr. Helen, it's already 30 minutes. Why don't you give us take-home message, please?
Sure. I would say the take-home message would be the goal of skin restoration is prevention. So start young and don't forget about your skin, because a lot of times we're so concerned about vitamins and everything else, which is very important, but don't forget about the skin. A lot of factors we have no control over, but we can do many things to prevent oxidative stress. So remember about that. Things like cover our skin from sun exposure or apply sunblock with minimal toxins in them. Eat food full of antioxidants. Get 7 to 8 hours of sleep. Drink 3 to 4 liters of water per day. Quit smoking. Have good face hygiene, such as washing face. Apply moisturizer. Use tailor-made skin therapy to address your particular skin issues so you don't waste your time and money with other products.
Oh,
that is all.
Okay. Thank you so much. And no, Dr. Cynthia, eucalyptus is used after they bite you, okay, the mosquito bites, but lemongrass probably is because of the smell, and also citronella And one more is take a lot of vitamin B complex. The smell make them not attack you. That's about mosquito. You know, I used to live in a tropical country, so our enemies is mosquitoes. And when they bite me, oh my goodness, you know, it will swell up. So for everyone, it's already 30 minutes and past, and I would like to thank Dr. Helen Kizler here from Earth Compounding Pharmacy. But I think the website, did you change your website to earthcompoundingpharmacy.com?
Yes.
Okay, so it's earthcompoundingpharmacy.com as it's practicing in Pasadena, California. Thank you so much for sharing with us. I'm Dr. Maria Cilindro, specialized in anti-aging medicine, practicing in Pasadena, California. I will see you next week, and thank you for supporting our channel. Please like Dr. Helen Kizler's today, and also share this channel with your friend after you subscribe it. Thank you so much.
Thank you so much, Dr. Maria, for having me.
Thank you. You're welcome. Have a nice weekend. Bye.
Bye-bye.